So just to let you know that I'm here working with this beautiful community of Latinos here in North Central Florida. We're an organization that's been around for 30 years. And so we've had a little bit of experience of seeing the shift and changes within migration. So it's been a little of an anthropological experience as well as a health justice program. We, focusing in on health justice, are concerned with the challenges experienced by those that oftentimes are essential workers, those that are here with or without status, and those that really are coming from a vulnerable experience and living within a vulnerable reality. So these are just some of the beautiful faces of the communities that we serve. I think what's important is to kind of probably share with you a little bit about our approach, and that is that we really believe that community members have a lot of the answers to their problems, and they have a lot of the strength and capacity. I think our job is to really help people to read what the reality is of where they are and what they're experiencing and the way in which they want to move forward, and support them as they write their own history, the futures that they have for themselves, and especially for their beautiful children, because so many of us have migrated historically in order to move ahead, salir adelante, and to improve things not only for ourselves, but for our children as well. So to do that, we really believe in three very concrete approaches that are critical to all of the work that we do. Now, I need to say that as the Rural Women's Health Project, we serve Latino immigrant communities, many of which are farm workers, but we also work with multicultural women living with HIV. And so within that work, I think that these three tenets that we follow really help to give people an understanding of how we place the community in the middle, in the front of the work that we do. So it's about realistic solutions to real problems. If we're talking from a traditional health perspective, if you're a person that has certain health conditions, you may need to be careful of your diet. Recommending to those that I serve that they use a pure vegetarian organic diet means that you're not really thinking at all about the realities and the barriers that our community experiences, and that is in living in areas where there are food deserts. So within that, what that really means for us is that we need to then model or the behaviors or actions that we're encouraging in our health work. As a health justice group, we do not provide direct health services in the majority of cases. We are actually there providing information, linkage to care, and really working with those that provide care to be better receivers of the communities that we serve. So part of modeling that behavior is in the education materials that we produce, the approach for the campaigns that we coordinate, and certainly in the materials that we develop. Because at the end, what we want is everyone to have this idea of sharing what they've learned. So if I received a piece of information and it resonates with me, I am going to pass it on to my neighbor, my sister-in-law, whoever's closest to me. And that's important to the work that we do. Because we're talking about barriers to health justice. And barriers to health justice, as I think most of us know, are really formed, it's the old discussion of the zip code, where you're born has much more to tell about your health future than your economic status, though oftentimes those go hand in hand. I'm working with community members that were born in places where they may not have had a zip code to start with, born in Latin America, and embedded determinants that is full of heart and love in the beautiful communities and homes that they were grown into, but also the economic and political realities that often force them to migrate to the United States. So within that, everyone thinks, oh, you're a health justice group, that should be easy. All you need to do is direct people to where the medical clinic is. And what we really tend to forget is the whole, I'd say, minefield in order to get there. Because the process of migration for any of us that have gone from one place to the other is full of a myriad of challenges, right? In addition to those that we have just as individual people. So we may be going through issues of stigma. In my case, when I moved to Central America to live, standing out different than my family, other challenges like that. But the emotional, sexual, physical exploitation that many of our community members experience, as well as the reality of racism, xenophobia, classism, and so forth. So getting to that medical system for many of those that I serve is not an easy process. So it's really about this woman at the center. How do we support this woman who in her case is a farm worker, an essential worker? How do we help to give her the orientation she needs? Well, we go to the community, first of all, that's important. We also train community health workers who hand out materials such as you see that's in the middle, materials written by the community themselves, in addition to the health centers that we hope will be serving them. And so we look at really using popular education materials. Fotonovelas are our favorite tool. This idea of using community members who become the actors in the pieces. It helps them to better represent. When I look at the woman off to the right, she looks a lot like my sister-in-law. So when I see it, I go, oh my God, mira, la Sara estaría, you know, Sarah's there. I want to see what she's talking about, right? Or the topic itself, the idea of saying reality. What is reality and how is it based? So using these popular approaches. We also create games because I'll be clear that many of those that we work with may be limited English proficient speakers. They may also be limited Spanish speaking proficient individuals speaking indigenous languages. That's really goes back to that idea of over 30 years, the migration stories have changed. So this is like a bingo game, la loteria, where we can use visuals as a way to talk about how to reduce your risk for COVID. And again, involving a great swath of community members participating means that they are going to be those that are going to do the each one, teach one, and take it back to their community. We also work with young people, and that was a program. This magazine was written and designed by 3 young women under the age of 18. They came together after we had done a survey of 100 women in North Central Florida, their mothers basically, shared with them what the results and concerns were that their mothers experienced, and they wrote a magazine that responded to many of those challenges in their own words through their own research. And then the last part of our work at the Rural Women's Health Project is really about advocacy. So we do not speak for communities, we speak with communities. And oftentimes that does mean that I may be the person speaking to a congressional representative, but the words and the message comes directly from the community. So this is the community that we serve at the Rural Women's Health Project. Amazing women, all these that are here are all community health workers, powerful and concerned about changing and improving their lives, as well as those of their community. It's the great families and children, whether it's the young people off to the left, who we work with to design their own health education material about HIV, where they get to plan it out, they get to act it out, and then it's printed and distributed. And then, of course, we work with farm workers, men, women, and children, who are the most amazing, powerful, and dignified community of people who feed us. And so our appreciation is deep. And that means that we bring health care to them. So as a health justice group, we are trying to link people into systems that exist and help them to be stronger survivors within our environment here. But we know that oftentimes we need to bring the care directly to them. And these are the annual health fairs that we provide in our area, which is rich in the harvesting of blueberries and watermelon. And then the last, which I think I've been here for 30 years, I'm one of the founders of the organization, is when I reflect back on impact, I had forgotten for many years, really all of these amazing interns that come and work with us at the Rural Women's Health Project. The majority of them are either foreign-born or first-generation college students. The majority of them are Spanish speakers, or we've had some Haitian Creole women working with us. They're the ones that are really about the future, and they help to model when we work in the communities, the work that we're doing. But the 2 women on the outside of this picture are actually now in medical school. The young woman in the middle is a licensed nutritionist, and they are our future, because I think the experience they have working with this beautiful population allows them to be more informed and concerned. And so here, as we have Doña Maria, one of the women who work with us in developing a couple of our health materials, we reach out our hand to you to see how we may be able to share with you some of the work that we do, and just tell a little bit more of the story of North Central Florida. So